So I wanted to talk a little bit about 3D planning and how we do this to optimize the aesthetics, TMJ and occlusion, airway with orthognathic surgery. You know, it's been really quite an evolution. When orthognathic surgery was first introduced, there were many 2D tools, so two-dimensional tools that were all separate and not really directly interlinked. So you would look at the patient and have sort of an understanding of the morphology or diagnosis. You may get a two-dimensional X-ray. You may get a plaster mold of the teeth, and then you would try to integrate these together. Frequently it involved having these stone models mounted and, you know, directly manipulating these in space in a laboratory. However, those models had no indication at all of where the bone is, where the bone's located, where the airway is, what the septum looks like, where the tongue is, or really any of the anatomy that ultimately we care about. So with these 3D tools that we have now, the occlusion is important, and that's the first step, but it's kind of the base level of planning. So our initial phase is we will set the occlusion to how we want this to be, taking into account any post-surgical orthodontic movements, any potential for small amounts of relapse. But then it kind of ends there with the occlusion, and then we really zoom out and start looking at the bone. So with the 3D tools now, based on this occlusion, I can reposition the upper jaw, the lower jaw, look at it from every vantage point, from a frontal view, from underneath, from left side, right side. We can change or alter what's called the occlusal plane, the mandibular plane. We can look at how this is impacting the nose, where we're coming to the sinuses, where the nerve is, and we can also, on the next level, move to actually designing plates and screws that can be 3D printed that, based on our final movements digitally, will help us recreate that exact movement in space. So 3D planning, it's amazing, and it moves beyond just thinking about the bite. The bite's important, but we really want to ultimately understand where the bones will end up, and we want to put those bones in the best place to optimize aesthetics, to improve the TMJ function, to improve the airway. And we have tools, 3D printed plates, cutting guides that will really help us establish that. The next level is going to be simulations, and how do we move the 3D facial bones, and how is this going to impact the face? And I think that's, there are some tools available now, but they're somewhat rudimentary, and we're working with a team of people to try to get as accurate of soft tissue simulations as possible, and that will really be game-changing as well. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.